Welcome back. Now let's shift gears onto matters health. Umbilical cord care is a topic that is less discussed in the postnatal period despite the fact that poor handling leads to various illnesses and even death. In a county like Bungoma, ranked among the 6 counties with the worst newborn mortality indicators are 32 deaths in every 1,000 live births, the introduction of a groundbreaking antiseptic medicine to prevent newborn deaths due to infections is saving the children. Our reporter Omo Nyango brings us this story and the organization at the center of this ingenuity.
The overwhelming love, instant happiness, joy, and even tears that come with the birth of a child is a roller coaster of emotions out of this world. But with every birth is a challenge of taking care of the newborn, and with parents spending less time in the hospital after successful delivery, taking good care of a new baby is a problem. Statistics globally and nationally place Kenya as among the countries in the world with poor newborn health indicators. Our journey to Kopsiro Modern Health Center in Kapsokwonyi on the slopes of the once conflict-prone mountainous Mount Elgon constituency in Bungoma County is one full of marriages. The sorry state of the road and the hilly terrain perhaps being the biggest impediment to access to healthcare services for the residents here. Although the country has made significant progress over the past 2 decades in reducing newborn mortality, the rate still remains high at 22 deaths per every 1,000 live births. This is in stark contrast to specific counties like Bungoma, which is among 6 counties with the worst newborn mortality indicators at 32 deaths in every 1,000 live births, way above the national rate. For the longest time, use of clinical spirit was recommended to a majority of mothers to clean the umbilical cord. Others, however, like Violet Ndiema, a mother of 6, opted for more unsafe methods like traditional herbs and cow dung, leaving the newborn babies with terrible infections.
Inahitaji mjusikafiri. Nilikuwa natumia bobe mjusikafiri kuweka kwa hiyo kitofu ili ipone. Nilikuwa naitoa tu hapa kando kando ya nyumba. Ilikuwa inakaa inatoa usa. Nimewafanyia 5.
Violet and other mothers now can breathe easy with the introduction of a locally available sterilized water solution for umbilical cord care. Newborn mortality has been a persistent challenge in most of the low-income countries in the world. A few years ago, it was assumed that improved socioeconomic status and a better healthcare facility would improve and impact greatly on these facilities. But do you know that a very simple public health strategy called the Chlorhexidine could go a long way in reducing neonatal deaths in the world?
Chlorhexidine is a broad-spectrum antibiotic that is applied on the cord, and it helps in the prevention of infection of the cord by preventing the colonization of bacteria on the cord.
Herbert Ogoti, the nursing officer in charge of this dispensary, shows a new mother how to apply this gel, which has turned out to be a game changer. Locals have embraced it as it directly addresses neonatal mortality, which is a burden here.
Nafinya yote kabisa mpaka hichi. Kisha maliza unatumia kidole mpaka kwa ngozi huku na mahali wamekata hapo, na hakikisha kwamba hiyo nini yote iko na imeguzwa na dawa sawa.
A CHX gel formulation which is waterless, portable, safe and efficient is effortlessly placed in childcare area for use by mothers and other family members, as well as placing them in birth attendant kits as an essential medicine as recommended by the World Health Organization.
One, because it is cost effective. It is something that a low-income earner is able to purchase from a local chemist, and I think it goes at around 80 shillings to 100 shillings. It's very simple to use because there is a job aid that is written on the box, and there's a leaflet inside that shows the mother on how the application is done. Unlike other antiseptic, it does not contain the alcohol. It's not alcohol-based, and therefore it does not cause any skin irritation.
The use of this low-cost, low-technology gel could break through barriers to markedly reduce neonatal infection and in extension deaths, as evidenced by this chart on the wall of this facility.
According to our data, the facility data, we had so many cases of neonatal sepsis, but after the introduction of chlorhexidine, I want to say that there's been a significant reduction in the cases of neonatal sepsis that we are seeing within the facility. Is the difference.
There has been calls for more resources to be put into research and innovation like these for preventing neonatal deaths. Save the Children, a non-governmental organization, is leading the way in the rollout of this gel in 21 facilities in the county.
The managed access program that Save the Children is doing is almost coming to an end. So the county should ensure that there's no stockout of chlorhexidine so as to continue to significantly reduce the neonatal infection, sepsis, and ultimately neonatal mortality.
This was achieved through a partnership with drug manufacturer GlaxoSmithKline Kenya to develop a sustainable supply and financing cost recovery mechanism to scale up introduction in this area.
By a survey that was done by UNICEF, it showed that Bungoma had vulnerable children. A good number of children were vulnerable, and therefore it was good for Save the Children to come and intervene. Maternal newborn health was actually a key project for Bungoma, for Save the Children, especially in Bungoma office, where the skilled deliveries was quite low. It was about less than 50%. So many mothers were actually delivering at home, and that led to a lot of neonatal mortality.
There is, however, need for the county government to take this up after the pilot phase is over. Omo Nyango, reporting for Tokel on KUTV, Nairobi.